My parents have been at Pleasant Manor for almost 14 years. They started off in the townhouses, went to an apartment, and now they're both in long-term care.
They can get out in the hall here, and we have these different rooms, the library there, and then you got the fish pond there, and the ducks are in there and everything. They're sitting outside there watching them and looking at them. And
I've been very impressed with the love and compassion that's shown all the residents, and it's really a good feeling for me to know that they are loved and cared for and in a safe place.
And there's one thing that I really like, that people get along here. The nursing staff they are qualified.
So it's called wraparound care, and ideally we follow along as disease and needs progress. So part of the benefit of that is that there's a long relationship between the residents and a lot of the caregivers and the full care team, and I think that matters.
They're all very, very devoted. They will welcome you and make you very comfortable. And I'm glad I'm here.
They love my dad. He has advanced dementia. He's funny, but he can be difficult at times. They just love him and appreciate him for who he is. So that's really important to me.
For me, it's a smile as you're leaving, after you've helped someone, is thank you, appreciate that, and even if they cannot speak, it's, you know, I sense it.
I don't know where to find them, but they're good. They are. They just don't cut you off short, you know.
If you want something, they try to help. And so so you actually are comfortable.
I get paid, I get benefit, everything, of course, that's important for me. Just to make people happy, to make them relief from the pain what they are.
And essentially that's why we're here, is to serve and with dignity and respect, and not just in providing the needs, but making it a home.
And one of the reasons why I came to work here was because I was recommended, and when I did come here, I do believe they hold that in high standards, like providing love, dignity, and respect to the residents and to the staff.
And when I came, I remember saying to my husband, wow, these Christians, they're on to something. This is such a nice place to work. The residents are kind. They have some values that made me want to stay and be a better person. And
people that are churchgoers, they have it here. They can go to Bible studies.
I know for my parents, they've really appreciated it. Just being part of their heritage, their environment, their community.
It's open to other faiths, and I appreciate that.
And yes, there are different faiths that are present. It does have a good feel to it, a good vibe.
So I think that the atmosphere in the home shows care. It's not an institution. You notice that right away.
It's usually scary when you start a first job, but with the staff being so friendly, so open to new people coming in, like you just feel like you just fall right in.
Our interactions as a leading educational institution with your facility, I think, have been very mutually beneficial. The therapeutic recreation students who ultimately will be going into fields associated with geriatric care in many cases are there practicing their craft, I guess, in some ways, and also looking at ways that their education can impact the clientele that you have. So it's a symbiotic relationship that we very much value.
teamwork is a huge factor. It's not your resident, my resident, you know.
I have two siblings that live out of province, and it is very important for them to have a peace of mind too, that our parents are looked after and cared for well. They are very thankful that the burden of care and worry for me is lessened because they're in a good home.
It's surprising how many people that you know before they get here, and we all end up at Tabor Manor. Like being at home.
And it's been so good that both Marlene and I have our names on the waiting list already, and we're looking forward to it when our time comes.
So you couldn't ask for anything better.